So I think throughout this evening, we've been talking a lot about how everything has very quickly had to move to more of a digital platform, especially whilst lockdown was in place. And it's very fair to say that GP practices and our healthcare system has had a shift to move to online and telephone appointments. I don't think that's a bad thing. I do think that this is here to stay and that there will be face-to-face appointments as well, where it is appropriate. But by having online and telephone appointments, it does mean that the GPs are able to complete more appointments with people. And at the moment, the requests are coming in thick and fast. They are at capacity, if not over. So I think it's really important that we embrace the changes, but also recognise that they won't work for everyone. And we have to think about our communities that are either digitally excluded or may face barriers when accessing online or telephone appointments. We've also, a positive, we've moved a lot towards e-prescriptions, so people being able to just call their GP practice, have a conversation and have the prescription delivered directly to their local pharmacy, which avoids them having to leave the house, sit in a waiting room with other people where they might infect or get infected. And we've also started rolling out virtual outpatient clinics. I think with all of these, it's really important to say that they were on the horizon anyway, but COVID just sped it along a lot quicker than it possibly would have been otherwise. And the last thing to mention, which isn't really COVID related because they were already in plan when COVID hit, but we have two new services via NHS 111. We've got the NHS 111 First. So if you've got an urgent query, which is not an emergency, but you do need to go to A&E or the emergency department, you can actually call 111 and they'll book you in an appointment. So you don't go and sit and wait for 4 hours feeling absolutely dreadful, waiting to be seen, but actually have an appointment time when you can go in and be seen straight away. And we also have the NHS 111 Clinical Assessment Service. So that service enables the caller to have a discussion with a clinician without having to go to their GP practice or go to the hospital. So it might be that you might be asked to help with supporting interpreting for either of those.